Governor, some states have been operating under an 1115 waiver. You mentioned Arizona has been operating, I believe, since 1982, well, at least 30 years. Some have suggested Congress create a process where long-standing core elements of an 1115 waiver can be effectively grandfathered into the state plan amendment. Do you have any thoughts on that? And I know that the doctor had mentioned that too. I'm just following up on his question.
Yes, sir. I think that's absolutely a step in the right direction, that if you've got a demonstration project that has demonstrated that it works, yeah, that you're able to do it in a budget neutral or better way, and that the outcomes are what you were expecting and what you told was going to happen. If that's the case, at some point, it shouldn't be years and years and years later. At some point, you ought to just be able to make that permanent. And I think importantly to your sister states, if we are the laboratories of democracy, and if Florida's got something that really works, it ought to be easier for us to go adopt what Florida's doing, make some adjustments for us, but generally adopt what is proven to work in another state if we choose to, and not have to go through a big, long process. It takes 337 days.
Sounds good. Thank you. Mr. Salo, one of the things that the many Republican governors have been interested in, they're interested in using 1115 waivers to test consumer-directed accounts with modest copay structures to encourage health literacy and individuals participating in their own health care. I agree with that. CMS has approved a few demonstration programs for this, but they have been stringent on the copays under the waiver program, I understand. How do you think that fact squares with the reality those consumers who make a few dollars more are suddenly expected to be shoppers on the exchanges? For example, at 133% of the federal poverty level, you could be on Medicaid with no copay, but at 134% of the federal poverty level, you would be on the exchange with no copays.
Yeah, I think the issue there is, and again, with deference to the administration's priorities, every administration is going to have priorities about what it wants to see done with its share of the Medicaid dollars. The current administration is not a huge fan of copays in the Medicaid program, but I think it is clear that a key point of what we need to do in the overall system to make healthcare better for people is that we have to have greater accountability, but for everyone. Yes, we need better consumer engagement, but we need to make sure that consumers have the tools to be able to do that effectively. And we need to also make sure that providers, primary care physicians or what have you, are accountable. We have to give them the tools to be able to do that. And ultimately, whether it's a health plan or whether it's the state, we have to have the tools to create an environment where all of those other pieces can succeed. You know, we don't want to just leave anyone out there with, you know, here's a ticket, good luck out there. We have to create, you know, it's not the Peter principle, it's the Peter Parker principle. With great power comes great responsibility. We've got a responsibility to be able to ensure that everybody within the system is going to succeed as we change it from a dysfunctional fee-for-service model to a better integrated, coordinated, managed care model. And that's going to involve consumer engagement, provider engagement, and state engagement as well.
Thank you. Last question, Governor, CBO has indicated that Obamacare's Medicaid expansion would on balance reduce incentives to work. Yet CMS has refused to approve work requirements as part of the Republican governor's state demonstration waivers. Are you aware of anything in Section 1115 that would prevent CMS from approving work-related requirements?
No, sir, I'm not. And clearly, having a planet where more people work in our economy, today only 48.5% of adult Americans have a full-time job. The labor participation rate is about 62.9%, the lowest since the 70s. before women had really come into the workforce in the numbers that they have in the last 40-something years. So yeah, it's absolutely, now that we allow able-bodied, childless people to be on Medicaid, there's absolutely no reason we shouldn't look back at Bill Clinton's welfare reform law, which had work or retraining requirements.
Thank you very much. I yield back, Mr. Chairman.